Hey, I'm SaraBeth Askins. I'm a certified nurse midwife and a women's health nurse practitioner. I'm from Birmingham, Alabama. I went and did my undergrad nursing degree at Samford University, and I worked as a bedside nurse throughout the Southeast, either in permanent positions or as a travel nurse, in labor and delivery, and then in different aspects of women's health. I decided to go back to school to pursue my master's in midwifery and to become a women's health nurse practitioner. Here, we will offer, full scope midwifery care, which a lot of people hear midwife and they just think like, oh, you're just going to deliver my babies and that's all you'll do. But actually we can see patients from puberty on through menopause. So if we meet you because you're pregnant and that's how you got to us, that's great. But we also want to encourage our patients to stay with us, to have that continuity throughout their lifespan. I definitely think the certified nurse midwife route is becoming more popular. We are discovering, and research is showing in the medical community, that birth is a natural physiologic process. It's not a problem to be solved. And midwifery is able to fill that role of really being with the woman through that natural process and not medically managing something that doesn't need to be medically managed. Midwifery aims to focus on honoring that process and really sitting with the women through that process. And I think our approach is low intervention, low risk, and that is very attractive to people here recently, especially, people don't want all of these things done to them that they don't really understand, that they're not fully comfortable with. And so by seeing a midwife, they're a little more comfortable knowing that we're down in the trenches with them. The beauty of certified nurse midwife working in a hospital setting, we collaborate with a physician. So while we carry our own independent license, we still work, in a very close partnership with a physician. Because in those high-risk situations or when complications or emergencies arise, we need the physician backup because there's a limit to what we can do, and that's where our physician partners step in. It's very easy in the clinic if we have abnormal results or we have something we're worried about. We just walk over and say, hey, will you look at this with me? Will you double check? I think she needs to see you next time because these things are trending outside of the normal range. And so then it's super easy to hop on a physician schedule. And then going forward, now you have two people taking care of you, two very dedicated people looking out for you, looking out for your family, and then even up through delivery. Even if, something emergent happens, you end up in a C-section that you didn't want, we're still right there with you. We can be in the OR with you, supporting you through that. As a bedside nurse, it was challenging to just be with patients and with their families just in that 12-hour, sometimes, up to 36-hour moment where it was very brief and there was not a lot of support that I could provide outside of the hospital setting. I found that most mothers and families needed a little bit more support, encouragement, education throughout their whole pregnancy and then even after pregnancy and beyond. And so that's where midwifery came in and kind of helped bridge that gap where you're able to build those relationships and be with your patients really from very early stages, hopefully throughout their lifespan. It's the relationships we build with our patients. And when patients feel seen and heard and their opinions valued, it's, a game changer to making a patient feel heard.